list is comprehensive and disturbing. Virtually all of those who succumbed to COVID-19 in Cook County had heart disease or high blood pressure or diabetes in their 50s, 60s, 70s, 80s, and 90s. The comorbidities are so common in this country, doctors are concerned.
The risk for getting the infection is not increased, but if you have the infection and underlying heart disease, the consequences not only are more serious, they can be dire.
More than 18 million people ages 20 and older have heart disease. It's the #1 killer in the U.S., and people with it are 50% more likely to die from COVID-19.
We have to be very careful with some of the original language that suggested that this was a trivial illness for younger people. They can become carriers. It can impact their older adult parents, friends, grandparents, so that's a concern. But particularly if they are the ones that have underlying heart disease, and again, it includes high blood pressure or diabetes, once this infection occurs, it can have grave consequences. And unfortunately, we're seeing deaths in people in their 40s and 50s. That is very chilling.
To understand the danger of COVID-19, doctors are looking at how it attacks the cells and ultimately grows in the respiratory tract. COVID-19 gains entry through the nose, eyes, or mouth. The droplets from an infected person who comes within 6 feet of someone else are able to either land on surfaces and be picked up on the hands or go directly into the face of an unsuspecting person. Alone on a table or door handle, the virus cannot replicate, but it can live for a time, waiting to be picked up. Once the particles are in the body, they attach to cells where they thrive and replicate, beginning in the mucous membranes of the nose and throat. Those spikes, which are so descriptive of coronavirus, latch on tightly to their new host. The latest research shows high levels of the virus in the upper respiratory tract first, but as you breathe deeply, the droplets are inhaled into the lungs, where COVID-19 has a special protein that acts like a tentacle, binding to cells in the lower respiratory tract. Soon, millions of viral particles flood the body. That's when the immune system begins to wake up, creating a fever in an attempt to kill the virus. But the immune response also causes inflammation, making it even more difficult for people to breathe. In China, roughly 80% of people recovered from this phase of illness. But for some, as the virus takes up residence in the lungs, new disorders overwhelm the body, infecting the cells that line the air sacs. Pneumonia develops as the lung itself is damaged, not just the upper airway. How does that differ from the flu? The flu often leads to bacterial pneumonia, with one area of white, a very dense infection. In the case of COVID-19, the lungs turn gray all over as the infection works from the outer air sacs of the lungs. Fluid, pus, and debris build, and patients develop acute respiratory distress syndrome, or ARDS. There is no cure for ARDS. Ventilators buy time as the body tries to heal, but the lack of oxygen and assault on the body put a tremendous strain on the heart. Many patients develop heart failure. Those with weak hearts to begin with are most at risk.
If ever there was an opportunity to really embrace the public health messaging of social distancing, but if we can practice these important public health measures, we really can flatten the curve. People may tire of hearing that phrase, but I'm not going to tire of saying it, because I think that the exposure here is to a very dire consequence.
It was a